medicine at Loma Linda University. In this video, Dr. Sehult reveals fascinating new insights on how sunlight impacts our health, energy, and longevity, benefits that go far beyond vitamin D alone. Backed by cutting-edge research from around the globe, he shares 3 simple, actionable ways to safely maximize sunlight exposure in your daily life. First, let's hear a story about a boy from Minnesota who was able to recover from leukemia with the help of sunlight.
So this is a story by a lady by the name of Amy Honmeyer. Her 15-year-old boy was diagnosed with lymphoblastic leukemia, went into the hospital, actually started chemotherapy for it. The treatment for blood cancer is chemotherapy, which he started. The side effect of chemotherapy is suppressing the immune system. Unfortunately, he didn't realize it immediately, but he developed a fungus flesh-eating infection in his lung. Got worse. And got worse and got worse to the point where the only way that they could control this infection was to actually remove his left lung, which they did. He starts to decline even after that. They do a CT scan and it shows that now the infection has moved to his remaining right lung. The doctors, have done everything they possibly can. They ask the doctors, how much time does he have? They say 2 days. In this situation, they ask this boy, okay, you're gonna die. What do you want to do? Surprisingly, he says, I wanna go outside. I just want to go outside. They get this boy, the hospital bed outside. He's on a BiPAP machine the respiratory therapists have put together. So this guy is outside. This guy does not die. After the first day, his white count starts to come down. By the second day, the white count comes down even more. His oxygen requirement is coming down. That's a good sign. He's requiring less and less oxygen. By the time he gets to day 5, he's off the BiPAP. He's on regular just nasal cannula oxygen that you see people wearing on their nose. Because on the CT scan, obviously the left lung is still gone. But the right lung, the disease is probably 60, 70% gone. He's still alive. He goes home. There's no sign of the disease after treatment. But this is what we used to do. When we built hospitals at the turn of the century, we had hospital rooms where beds could be taken out onto the veranda and people could get sunlight. There's studies that have been done. People in a 2-bed room, if you're the bed closer to the window, you get discharged from the hospital faster, on average.
Now let's check out 3 fascinating studies on how sunlight affects our health, one from Brazil, another from Sweden, and the third from the UK. Brazil's light vest research.
In Brazil, they took COVID patients that were sick enough to be admitted to the hospital, but not too sick to be intubated in an intensive care unit. They actually manufactured a jacket that they could put on patients. And on the inside of this jacket were these LED bulbs that gave off infrared radiation at exactly 940 nanometers. They put the jackets on, they randomized the sign which jacket was turned on and which jacket was turned off. It was blinded because the light coming from this jacket could not be seen by the human eye. They did this on 30 subjects. All 30 had the jackets on, 15 had it turned on, 15 did not have it turned on, and they watched them. What happens to these patients? Every single endpoint that they looked at was statistically significant. The differences between these two groups could not have been from chance. The group that had the jacket turned on had improvement in their oxygen saturation, could take breaths in more deeply and stronger, had improvements in their white blood cells, had improvements in their heart rate, their respiratory rate, all of these statistically significant. But the most important and mind-blowing statistic was the length of stay in the hospital. So they had these jackets on for 15 minutes once a day for 7 days. Group that did not have the jacket turned on, their average length of stay was 12 days in the hospital. For those that had the jacket turned on, it was 8 days. That was 4-day difference. That's tremendous. People were discharged from the hospital 4 days faster.
Sweden's study over 20 years.
The Swedish study is groundbreaking. This was a study where they asked 20 to 30,000 Swedish women about their habits in sunlight. They divided these women into 3 categories. Those women that did not get a lot of sun, those that got a moderate amount of sun, and those that got a lot of sun. And they followed them for 20 years. They kept a track of each one that died and what they died of. And when they were done with that, they were astonished because what they found was that the women who had spent the most amount of time outside had the least amount of mortality from cancer, from cardiovascular disease, and non-cardiovascular disease. And those that spent the least amount of time outside had the highest levels of that. The magnitude difference between those two was so much that they were able to show that women who spent the most amount of time outside and smoked had the same mortality as those women that did not spend as much time outside and did not smoke. In other words, being in that category of not spending much time outside in the sun was the same risk factor for death as smoking.
The UK study over 100,000 people.
Richard Weller, who's a dermatologist in England, did just last year a very similar study as to the Swedish study, except it was 10 times bigger. He did it with both men and women. He found the same results. He discovered that either from solariums or being outside using solar radiation data, he was able to show both on their questionnaire and also where they lived that the more light that they had, the lower their risk of mortality and cancer mortality. So the question was, does it increase melanoma? Melanoma is a skin cancer. He was able to show that there's no statistical increased risk of melanoma incidence, but there was a reduction in non-skin cancer mortality. So here's the trade-off. If you want to go out into the sun in England, the benefits are you're going to have a reduction in non-skin cancer mortality. On the other hand, there's no increase in melanoma incidence.
What if the hidden trigger behind chronic disease has been right in front of us all along, and sunlight itself could flip the switch inside our cells? At the heart of this mystery are your mitochondria, the tiny power plants that fuel every function in your body.
What is the mitochondria? It's the powerhouse of the cell, right? It's the thing that makes energy. What we didn't know at the time is that as we get older, the output from these batteries in our cells drops by about 70%. Mitochondrial dysfunction. Depending on the cell type that we're talking about, that's going to have the issue. If we're talking about the heart's going to become more congested. If we're talking about the brain, it's going to have more dementia. This paper showed infrared light from the sun is able to penetrate probably up to about 8 centimeters, according to Scott Zimmerman in this article. And it fundamentally interacts with specifically the mitochondria. The mitochondria to the cell is like the engine in your car. So what do all internal combustion engines have? They have a cooling system. And that's exactly what the cell has to have for the mitochondria. It's not heat in the mitochondria, it's called oxidative stress. And it's specifically oxidative stress that causes destruction of the mitochondria and leads to these types of diseases. So oxidative stress causes the mitochondria not to work well. This leads to diabetes. Oxidative stress makes the mitochondria not work so well. This leads to dementia. The mitochondria makes its own cooling system. And that cooling system is melatonin. What Scott Zimmerman and Russell Ryder proposed in this was that basically the infrared radiation that's coming in to the body is able to stimulate and upregulate melatonin and a number of other factors that keep the mitochondria cool and can actually improve the energy output of the mitochondria. People like Glenn Jeffrey out of UCL is actually doing research at 670 nanometers of red light and has shown in randomized controlled trials that that type of light right there at 670, the type that you can even see, actually does improve mitochondrial efficiency. He's shown this in a number of randomized controlled trials. It improves eyesight, and you have to realize that the retina at the back of your eye is very rich in mitochondria. He's shown this in terms of managing glucose and output from mitochondria.
We know mitochondria are essential for keeping our bodies running at their best, and sunlight can actually help these tiny power plants work more efficiently. In this next part, Dr. Sehilt shares 3 simple ways to use sunlight every day to boost mitochondrial health. How long should you be in the sun to see benefits?
If you talk to Glenn Jeffrey, which I have, he noticed an improvement in 15 minutes. He said he has studied the mitochondria in fruit flies, and in mosquitoes and bees and in human beings, and it's the same every time. He says after about 15 to 20 minutes of this type of light in that type of setting, there is a switch that turns on, and you don't need further stimulation. Further stimulation doesn't do anything more.
When is the best time of day to get outside for maximum effect?
Optimal time of day to get sunlight would be for those that are concerned about getting damage from ultraviolet radiation. As we talked about, when the sun is low in the sky, that's going to be beneficial because the ultraviolet cannot penetrate obliquely through the atmosphere as well as long wavelength radiation. So when the sun is coming up and when the sun is going down in the evenings, that's going to be the time where you're going to get proportionally more infrared light and the least amount of ultraviolet light. Now, when the sun is directly overhead at noon, you're going to be getting the most amount of infrared light at that time, but you're also going to be getting a lot of ultraviolet radiation. And so if you're not someone that's gone out into the sun a lot, you may want to avoid this period of time. Or, as we talked about, put on a broad-brimmed hat. Put on clothes, more clothes, because ultraviolet light does not penetrate through clothes very well, but infrared light can. We're talking about with the mitochondria, it will not matter. However, if we're talking about circadian rhythm, if we're talking about getting the circadian rhythm, that pathway is through the eyes. So you want to maximize light through the eyes. Even on a cloudy day, Being outside, you're going to get more infrared light than if you were inside.
And what role does nighttime light exposure play?
So just as important as it is to have bright sunlight and getting outside in the middle of the day, we also need to start working on getting darker nights as well, turning things off, getting these screens away from our eyes. These are really important because the screens have a lot of light, and the light, what's going on here, this is the reason why it's important. There's two reasons actually, is the light that's going into our eyes is doing two things at night. Number one, it is shutting down melatonin production from the pineal gland. And as we just talked about, melatonin is a very powerful antioxidant that's very beneficial. The second thing that it's doing is it's confusing your circadian rhythm. You see, your circadian rhythm is designed to see light as day. If your eyes are seeing light